even though the majority of pituitary tumors are benign, it's scary to find out there's something there. So I think what's unique to my role and to us seeing pituitary tumors is we are able to tell patients that these lesions are most likely benign. So I think that right away reassures patients. Pituitary tumors are also more common than people realize. The other thing is I think we do a really good job of making sure the patients understand that we're going to take really good care of them. So when patients come here, they will be seeing doctors who are, experts in their field, who have a lot of experience treating these types of tumors, who have probably seen all different types, variations. So especially for the patients that have kind of the more rare types of tumors, we have seen it. It's not new to us, and I think that reassures patients. Whereas sometimes when they go to the community, if they have a rare disorder associated with a tumor, sometimes the physicians may not have ever seen it before. The reason that I became an endocrinologist was actually that my father had a pituitary tumor that was diagnosed when I was about 7 years old. And he underwent multiple treatments and had several complications that happened as a result of this type of tumor. I grew up seeing the effect of this tumor, the treatment he had, and it included a lot of hormonal issues. So it's one of the reasons why I went into endocrinology. And then specifically, when I was given the opportunity to start a pituitary center here, I jumped on it because I wanted to be able to treat, patients that were like my father. When I refer patients to some of my colleagues in the other disciplines, I can be confident that they're going to get the best care possible. One thing that I've been impressed with is the compassion that I see with my colleagues. So not only are they excellent surgeons, I would send my family member to them, but they are also extraordinarily compassionate, they're extraordinarily empathetic, and they have amazing bedside manner. And that's just been, I think, an amazing experience to be able to work closely with my colleagues. We have patients that we see who have pituitary tumors that often are associated with very complex medical problems. So patients often have medical problems that are affecting their physical health, that are affecting their mental health, their quality of life. Sometimes for some of them it's taken a really long time to get the diagnosis. And there's nothing more satisfying than being able to see them, a couple months and continue to follow them for years afterwards, after treatment, to see them having gone back to their normal lives, normal quality of life, to no longer have these debilitating medical problems. That's probably one of the most satisfying things about taking care of patients with pituitary issues.